Visit licensuraexams.com and try our samples completely free of charge.
In Part 2 of Avoidant Personality Disorder, we are going to explore 4 areas. 1. Key terms. 2. Similarities and differences with other disorder. 3. Techniques for working with clients with avoidant personality disorder. And 4. A summary of what you have learned. Let's get started. Terms and definitions. Let's take a moment to define some of the key terms associated with avoidant personality disorder. Understanding these terms is crucial for effective communication and intervention. 1. Avoidant personality disorder, characterized by a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. 2. Social inhibition. The tendency to withdraw from social interactions due to fear of rejection or humiliation. 3. Hypersensitivity. An exaggerated response to criticism or negative evaluation, often leading to emotional distress and avoidance. 4. Negative self-concept. A deeply ingrained belief that one is unworthy, flawed, or inferior to others. 5. Cognitive distortions. Irrational thought patterns that reinforce negative beliefs, such as overgeneralization, catastrophizing, and black and white thinking. 6. Attachment theory. A psychological model that explains how early relationships with caregivers influence an individual's emotional development and behavior in adulthood. 7. Avoidance. A coping mechanism where individuals avoid situations, relationships, or opportunities to protect themselves from perceived threats, such as rejection or failure. 8. Exposure therapy is a therapeutic technique used to gradually expose individuals to feared situations, helping them build tolerance and reduce avoidance behaviors. 9. Self-esteem. An individual's overall sense of self-worth or personal value. 10. Schema. A cognitive framework or belief system that shapes an individual's perception of themselves and the world around them. You need to know about similar disorders, how they are alike, and how they are different. Avoidant personality disorder shares similarities with several other disorders, making differential diagnosis an important aspect of treatment planning. Let's compare avoidant personality disorder with some related diagnoses. 1. Social anxiety disorder. Both avoidant personality disorder and social anxiety disorder involve intense fear of social situations and fear of negative evaluation. However, avoidant personality disorder is characterized by a more pervasive and enduring pattern of social inhibition and feelings of inadequacy. While individuals with social anxiety disorder may fear specific social situations, those with avoidant personality disorder often avoid all social interactions. 2. Dependent personality disorder. Dependent personality disorder and avoidant personality disorder both involve fear of rejection and dependence on others for validation. However, while individuals with dependent personality disorder may become overly reliant on others and seek out relationships, even unhealthy ones, individuals with avoidant personality disorder tend to avoid relationships altogether due to fear of rejection. 3. Borderline personality disorder and avoidant personality disorder both involve hypersensitivity to criticism and fear of abandonment. However, borderline personality disorder is characterized by a pattern of unstable relationships, emotional dysregulation, and impulsive behaviors, while avoidant personality disorder is marked by social inhibition and avoidance. 4. Schizoid personality disorder. Individuals with schizoid personality disorder and avoidant personality disorder both exhibit social withdrawal. However, those with schizoid personality disorder typically lack the desire for social connection and have a limited range of emotional expression, whereas individuals with avoidant personality disorder desire social interaction but avoid it due to fear of rejection. Paranoid personality disorder and avoidant personality disorder both involve distrust of others. But paranoid personality disorder is marked by pervasive suspiciousness and a belief that others are malicious, while avoidant personality disorder is driven by fear of rejection and feelings of inadequacy. Understanding the distinctions between these disorders will be critical when you have to choose between two different diagnoses when additional information is presented in a case study. Techniques for working with the disorder. Now, let's explore some of the most effective therapeutic techniques for working with avoidant personality disorder. These techniques are designed to help clients challenge their negative beliefs, reduce avoidance behaviors, and build healthier relationships. 1. Cognitive behavioral therapy is one of the most effective approaches for treating avoidant personality disorder. The focus is on identifying and challenging cognitive distortions. For example, a client who avoids social events due to fear of rejection might work with a therapist to reframe this belief and develop a more balanced perspective, such as not everyone will reject me, and I can handle the discomfort if it happens. 2. Exposure therapy involves gradually exposing clients to feared social situations in a controlled and supportive environment. For instance, a client who avoids public speaking might start with small, low-stakes speaking engagements and gradually work up to more challenging scenarios. The goal is to reduce the client's fear and avoidance by building tolerance to anxiety-provoking situations. 3. Schema therapy. Schema therapy is particularly effective for individuals with deeply ingrained negative beliefs. The therapist works with the client to identify and modify maladaptive schemas, such as the defectiveness that often underlies avoidant personality disorder. Techniques might include imagery rescripting, where the client visualizes a past traumatic event and reimagines it with a more positive outcome, helping to alter the associated schema. 4. Interpersonal therapy focuses on improving the client's interpersonal relationships and social functioning. The therapist helps the client explore and address the underlying fears and assumptions that lead to avoidance in relationships. For example, a client might practice initiating social interactions in therapy and receiving feedback and support from the therapist. 5. Mindfulness techniques can help clients with avoidant personality disorder become more aware of their thoughts and feelings without becoming overwhelmed by them. Practices such as mindfulness meditation can help clients observe their anxiety without immediately reacting to it, allowing them to make more intentional choices in social situations. 6. Self-compassion training. Individuals with avoidant personality disorder often struggle with self-criticism and low self-esteem. Self-compassion training involves teaching clients to treat themselves with the same kindness and understanding they would offer a friend. This can be particularly helpful in reducing the harsh self-judgments that fuel avoidance. 7. Role-playing is a powerful technique for practicing social skills and challenging avoidance behaviors. For example, a client might role-play a challenging social interaction in therapy, such as asking someone on a date. The therapist can provide feedback and help the client build confidence in their social abilities. 8. Group therapy offers a supportive environment where clients can practice social interactions and receive feedback from peers. For clients with avoidant personality disorder, group therapy can be particularly beneficial as it provides opportunities to challenge avoidance behaviors in a safe and structured setting. Each of these techniques can be tailored to the specific needs of the client, helping them to build the skills and confidence they need to overcome avoidance and engage more fully in their lives. In summary, avoidant personality disorder is a complex and challenging condition characterized by social inhibition, feelings of inadequacy, and a deep fear of rejection. Challenging cognitive distortions and employing evidence-based techniques like CBT, exposure therapy, and schema therapy, we can help our clients break the cycle of avoidance and build healthier relationships. Remember, our role as therapists is to provide a safe and supportive environment where clients can explore their fears, challenge their negative beliefs, and develop the skills they need to lead fulfilling lives. Thanks for joining me in this exploration of avoidant personality disorder. Remember, whether you're working with clients in individual or group settings, the tools and insights we've discussed today are resources you might employ as you continue your journey as a therapist and prepare for your licensing exam. Always keep in mind, it's in there. You can do it.